Welcome to the Sniff Spotlight series, brought to you by Renewal Rehab, a dynamic therapy company that provides full-service therapy for nursing homes. You'll be hearing from some of the leading nursing home professionals in the country, as well as many healthcare heroes that are sacrificing day in and day out to help your loved ones recover and come home to you.
I'm here with Scott Dykstra. He's the community liaison for Grace Hospice. Can you tell us a little bit more about what you do?
Yeah, thank you for having me on, Yitz. I appreciate it. So as the community liaison, my responsibility is managing the relationships with different community partners, whether that's a hospital, home health company, skilled nursing facility, assisted living, or memory care. So I build relationships and manage those relationships. And there's also a customer service component where I make sure everybody is happy and getting their needs met.
So how has the COVID-19 situation impacted you having relationships with those accounts? Are you able to visit them as much?
No. Yeah, as COVID has impacted most industries, it certainly has impacted hospice care. The biggest aspect is that facilities are closed to the public. So in order to be present in a facility, really you can't. You know, most people, you have to meet outside, or some facilities that we already have existing relationships and have patients in, we are able to meet, for short periods of time with smaller groups, whereas before, as a liaison, you would go into, any office, any facility, walk in, ask for a meeting, bring them food, do a training, all in person. Now a lot is done virtually, like us meeting right now. A lot of times we would be in person together. Also, of course, the masks. Masks are so important to protect each other. However, a piece of the personal connection is lost because when you're meeting with someone, you can't see all of their facial expression.
So how has the COVID-19 situation impacted your teams caring for the patients? How are the patients getting treated with hospice?
Yeah. So the care overall, it's the same good care that my company has always provided. They do have to use more personal protective equipment, masks, gloves. The biggest piece that has made an impact is that we really had to group our care teams so that they are only seeing a certain amount of patients. A lot more COVID and fit testing has had to be done. Fit testing is, are you familiar with fit testing?
No.
So that's with when an N95 mask is in place. N95 masks are actually only effective when you have the proper fit, no facial hair. So an actual fit testing that my company does, which is the correct way, is that you have to shave, clean shaven, and you have to get perfectly fitted with a mask, and you have to have a COVID test to make sure that you're not asymptomatic and positive before doing that. Otherwise, if the N95 mask isn't fitting or there's facial hair in the way, it doesn't fit your face correctly, there's actually no point to an N95. So that's a big piece of it. Then a lot of the non-essential visits have been refused by a lot of our patients, like the chaplain services and volunteer services that we used to do all the time. A lot more people are refusing those.
Oh, wow. So how have the patients been handling? I mean, these are terminally ill patients that don't have, doctors say they don't have such a long time to live. How have they been handling this emotionally and psychosocially?
Yeah, that I think with most seniors and most people has been difficult. We are all social human beings, whether you're an introvert or an extrovert. I'm kind of in the middle. Sometimes I tend to be a little bit more of an introvert. That's adaptive. We are all missing social connection. It is so important to all of our mental health. Particularly, most studies say that there's 4 pieces outside of the things that are not variable, that cause healthy aging. That's healthy eating, exercise, setting goals, and relationships, meaningful relationships with people that we love. When any of those four pieces are missing, it causes anxiety and stress, and particularly with relationships and goals and purpose behind that. When you're lacking that, it causes anxiety, and it causes depression, and can cause cognitive decline and physical decline. So we are seeing that a lot. There's a lot more depression, and particularly in seniors, because their ability to meet new people is a lot lower than the general population, and even more now,
And how has it been for the families? Are they not being able to see their loved ones as much? Like, how has that been affecting them?
It's been a blend. I think there's a lot of people that have said, like, I don't want to cause my loved one to get COVID, and so as much as it hurts, I'm going to try to, stay separate or repeatedly get COVID tests, wear masks, all that. And then there's other people and other families that have said, I have to care for my mother, so I have to go back and forth between my house and hers, and I could never be away from my mother. My mother would never want to be away from me, so we have to see each other. So there's a wide array.
So there's a wide variety sometimes of family members needing to choose in this emotional time who we're to send their parents and loved ones during during their sickness. What do you wish these family members knew that can help them make a decision of where to send their child, their loved one?
If they're choosing like a hospice company like mine, or they're considering that, or they don't even maybe know that the hospice benefit is there, I think I want people to understand that hospice isn't just throwing your hands up and giving up. I want them to understand that hospice is not a place. It's done wherever that person is, whether it's a facility or in their home, their own personal home. And I want them to understand that hospice is not giving up hope. It's transitioning hope. It's a service that is a benefit like Social Security that really makes a big impact for quality of days versus the time that's left. I want them to understand that it's about transitioning their hope to having the end of their day being a peaceful passing where they're comfortable and they're not in pain. They're getting all of their needs met. And that hope is in those quality of those days. Because that's truly what it's about is, Americans don't like to talk about passing away. It's something we like to avoid. We don't want to be old. We don't want to age. It's part of America's obsession with plastic surgery, right? But it's part of life. As painful as it is, it's part of the beauty of life is life and death and the joy and the pain. And we want to have a good care plan at the end of life, and hospice helps people do that. They help have a beautiful and peaceful passing, and that's what we're here to do at Grace Hospice.
And do you feel more people are choosing with Grace Hospice to go at home, or as opposed to others that would in the past have gone to SNFs?
I wouldn't necessarily say that. That's a good question. Because with hospice is a pass, when they're in a SNF, hospice is a pass through because all of the Medicare and Medicaid payments go through hospice. So we have to have a contract with the SNF, and then we pay for the room and board and the supplies and the medication. So generally, if someone's on hospice, they're not going to go out to the hospital. They're going to call hospice instead of 911. If they need to go into a SNF, then, they're going to do that. If there's a major incident, a lot of times if we're getting a referral from us, a lot of times we are getting a referral from a SNF, and then we're providing that hospice care in that SNF environment. So I don't know that people are necessarily avoiding SNF, because if somebody does need that level of rehab, you can't get it anywhere else,
What would you say that Grace Hospice does differently and better than some of the other hospice care providers?
Yeah. Biggest part is the team. That's why I joined Grace Hospice, is because I really believe in our nurses and our caretakers. Every single person on the team, including myself, was handpicked by somebody that has worked with all of us in the past and really trusts their care and their mentality. Truly, the leader brought people together that were like-minded, that really are compassionate, and that really care. So the team truly is the most important piece. In fact, several people on the team, the administrator was their hospice nurse for their loved one. So our bereavement coordinator and volunteer coordinator, she had a medically fragile 25-year-old daughter that passed, and my administrator was her hospice nurse. So when you've got these intimate relationships and people providing this care that are willing to work on the same team and come together, it really is proven that like they really believe in each other, because they were there for each other in a way that is profound, So it's about the team, because everyone on the team truly has a deep passion for good end-of-life care.
If you had 30 seconds, how would you comfort some of the critics of the industry, especially during this time, and explain that we really do care?
Yeah. There are a lot of people in the caring industries that a job is just a job, an industry is just an industry. Businesses do have to make money, so there is that aspect of it. But what I would say is that these services provide for the needs that people have. And, without them, could somebody have a peaceful passing? Potentially, but good end-of-life care makes such a big difference. Being able to have that support of nurses and the significant financial savings with hospice, paying for all of the supplies, medication, medical devices. Really, it's a service that you wonder, well, why wouldn't somebody accept that? I think the biggest piece is understanding that hospice doesn't mean you're throwing up your hands. It's not giving up,
Thank you so much, Scott. I appreciate your work and whatever you do, and I appreciate you coming on and taking the time to speak with me today.
Yeah. Thank you for having me. Hopefully I answered your questions adequately.
Thank you for listening to the SNF Spotlight series. Please subscribe to our channel, as there will be many new and exciting episodes from our healthcare heroes.